erect chest X-ray. Lungs are of normal volume. Right hemidiaphragm is slightly higher than the left hemidiaphragm. Unfortunately, we cannot manipulate window and level settings on this film to confidently comment on lung parenchyma, but we can roughly, if not confidently, say that there is no mass lesion. There are no areas of avascular region within lungs. So there is no sign of pneumothorax. There is no sign of consolidation as both lungs are filled with air. Both claustrophrenic angles, right claustrophrenic angle and left claustrophrenic angles, are clearly visible and are in their usual shape, suggesting there is no pleural effusion. Mediastinum is of normal contour. Right and left heart borders are sharp and clear. Ascending aorta is clearly visible. Arch of aorta is clearly visible. Descending aorta is clearly visible. Aortopulmonary window is very nice and clear, and very clear and sharp visualization of all these structures represent that there are no enlarged lymph nodes or no sign of lymphadenopathy in medical language. Angle between right and left main bronchus is less than 90 degrees, suggesting there are no enlarged subcarinal lymph nodes or anything that can produce a mass effect. Visible ribs and clavicles do not represent any gross abnormality. Trachea is almost in the midline. But the evaluation of chest X-ray would not be complete if you do not look at the subdiaphragmatic areas here and here. On the right side, you see a fine and sharp air density, which makes it possible to actually see and measure the thickness of the diaphragm. So because of this air density, you can actually see the thickness of the diaphragm. If it was not there, you would not be able to see the thickness. You would not be able to differentiate between the density of the diaphragm and the density of the abdominal organs here. Because of this air density under diaphragm, it is possible for you to actually measure the thickness of the diaphragmatic muscle. The air is not making any air fluid level and is not associated with any cavity. This is free air within the abdominal cavity or peritoneum. The condition is known as pneumoperitonuem. The word peritoneum refers to a membrane that covers the abdominal and pelvic cavities. A number of organs lie within this cavity, which normally is airtight. Means there should be no free air in this cavity. And again, it is normal to have gases in the stomach and intestine, but air outside these organs and within peritoneal cavity usually suggests that there are some areas of intestines that are ruptured, or even one area of intestine that is ruptured and has hole or holes in it, and food and air from this hole is leaking into the peritoneal cavity. Pneumo means air, as we all know. Pneumothorax means air in the pleural cavity. Pneumocranium means air in the cranial cavity. Pneumomediastinum means air in the mediastinum. If you look at here, this is the gas in the stomach, but then there are some air densities outside the stomach. So this is diaphragm, and this is most probably the thickness of the stomach wall, and this is free air between stomach and diaphragm, and it's the same here. And probably this air is in the splenic flexure. The most usual reason of this is perforation of intestines, which in a big percentage of patients happens because of ulcers. Ruptured diverticuli, necrotizing enterocolitis, and idiopathic gastric perforation are among other common causes of perforation, along with some other less common reasons. Ulcers gradually damage intestinal walls, finally making a hole through which food, water, and air leaks into the peritoneal cavity, making the condition a surgical emergency. If the patient is in erect position at the time of X-rays, such free air gets collected under diaphragm and is often described as free air under diaphragm. However, there are two very important things to remember. Number one, not all perforations will show free air in peritoneum, and free air in peritoneal cavity does not always mean that a patient has a bowel perforation. It is common to see free air in patients who have abdominal surgeries for any reasons, as peritoneum is open during the abdominal surgeries. Such air usually gets absorbed within days. Number two, the presentation of free air can be diverse and challenging. It does not always show as free air under diaphragm. There are several so-called radiologic signs that can be diagnostic. Double bubble sign, football sign, falciform ligament sign are few of many. Some of them are visible on supine abdominal X-rays, and some are even visible on, such as this one, on erect chest X-rays. The X-ray is courtesy of Dr. A.J. Chandrasekhar from his website. Thank you very much.